RSV is a virus that is very, very common. Almost everybody gets RSV at some time in their lifetime. The unfortunate part with RSV is it doesn't pass immunity from one acquiring to the other. What we're seeing this time of the year is a spike when we generally would not see a spike. RSV is more of a due winter, late winter phenomenon, and we're seeing it here in fall. Kids who are most affected are those less than 6 months. Those who are less than 6 months have about a 7-time the rate increase of hospitalization compared to those 6 months and older. So the message is those 6 months and younger, try to protect them as much as you can from siblings or other people in their daycare or school that might have a runny nose or a simple cough that might manifest as respiratory distress in the 6-month-old and less. RSV is something that usually equates to a common cold for those who are immunocompetent and those who are 2 to 3 years of age or older. But for those who have asthma or underlying lung disease like BPD or cystic fibrosis can have an increased risk of hospital need as well. With COVID, what we get on the admission side, so the kids are acutely ill enough to need an admission to the hospital, is more GI-related symptoms in the less than 6-month age range, as opposed to respiratory-driven symptoms with RSV. That equates to dehydration measures and less respiratory need measures. With influenza, we haven't seen enough cases. There hasn't been an increased rate of positivity to the point that we know what to predict for the influenza-related pediatric population this year. But with years past, influenza would present with a higher fever, 102, 103s, more malaise, not wanting to do as much, decreased energy, not wanting to take hydration, not wanting to eat. That's more of the influenza pathway with still less respiratory symptoms as compared to RSV. So the take-home message, if your child has increased respiratory concerns, they're breathing fast, they're using accessory muscles to help them breathe, that equates more to an RSV type illness as compared to COVID and influenza. Breathing fast and breathing with distress are two indicators that medical attention needs to be sought. Breathing fast, and I really want to focus on those 6 months and less, would equate to 60 times a minute or more consistently. And breathing with distress would be using the muscles between the ribs, the belly to help breathe, to show signs of distress. That would be immediate medical attention. Some of those things can be mitigated by suction. Less than 6-month-olds breathe through their nose, and so sucking out the nose to try to clear that airway will help tremendously with that breathing effort. I'm going to give a little mini pathophysiology because I think it's helpful related to RSV. So the first 0 to 1 day of RSV acquisition, you're going to have the heavy secretions. So you're going to have the suction needs. And then days 1 to 3, it moves to the lower airways, to the bronchioles, and increases inflammation, increases secretions in that lower airway. So that's when you'll see the signs of distress. You'll see the increased work of breathing. You'll see the faster breathing to try to clear those airways. And then days 4 and 5 are both of those combined, heavy secretions up top in the nasal pharynx, as well as the secretions down low. The good thing about RSV is once you reach day 4, day 5, you should be in the, okay, this is the worst part of the disease process state. So if your child can get over that hump and stay out of the hospital, we should be clearing the airway a little bit better starting day 6 because the lungs start healing. The cough might worsen day 6, but that's a good sign that we're trying to clear the airway. And then day 7, we should still have that mild cough, but we should be greatly diminished in the secretion needs. So about 1 to 7 days is the pathway of RSV trying to clear the body. The mainstays of treatment for RSV are suction and hydration at home. So utilize whatever suction technique technique you can to clear the nose and the mouth and make sure that they stay hydrated.